Hey everyone, welcome to Module 7. We're going to be learning about the components of the Comprehensive Evaluation Report. There's going to be some overlap between this module and Module 8, so you may want to refer back to this PowerPoint again when you're preparing to write your report. So the information in Module 7 and 8 pertains to evaluation reports for all ages and grades, and will be really useful for you in all evaluations that you might complete in the future. In addition to learning more about the components of a comprehensive evaluation, we'll preview report writing as the two modules really go hand in hand with each other. In the previous modules, you've learned a lot about assessment tools and assessing young children, but the vehicle to get that information to teachers and parents is the comprehensive evaluation report. So as part of the report writing process, you will need to incorporate formal assessments, and you'll also need to synthesize all additional data, which is going to be those informal assessments or that informal information, and include information from parents or teachers, other caregivers, any observational data. Could be information from doctors or private therapists, health history, developmental milestone achievement, age ranges from the transdisciplinary play-based assessment age tables. All of this data will make up your comprehensive evaluation report. Generally, in most school districts, the evaluation team will also include other evaluators. That could be the speech therapist, occupational therapist, physical therapist, your school psychologist, and it could be other related service providers as well. But for the purpose of this module and Module 8, you will be considered the only contributing member of the evaluation team. But I did want to touch on the fact that most school districts utilize a multidisciplinary team approach. Also want to touch on the importance of observational data, and even if you aren't relying on the age range tables from TPBA, you can still use a play-based observation for a wide variety of data. You can probe skills by playing with the child and guiding them through identifying colors and shapes, numbers and letters, positional words, animals, counting. You can also observe fine motor skills, gross motor skills, their communication abilities, all through observational play, and can use that in each section of your evaluation report. I know during COVID, maybe a little more difficult to arrange face-to-face play sessions. You could also give parents a list of skills and ask them to video their child and then send you the video. You could also arrange a play observation through Zoom, and then you can direct the parent kind of what to do in real time. While we, have focused on screening and assessment, I just want to sort of reiterate that observational data and other informal types of data are crucial to include in your evaluation report as you paint a picture of the whole child and their strengths and weaknesses. So let's go ahead and dive in here. So when writing a comprehensive evaluation report, you want to consider how you will organize the information. You can organize in a test-by-test format or synthesize the results and report in an ability-by-ability format. Either method is acceptable. You'll just want to choose one and then stick with that throughout your report. Start by discussing general findings followed by specific details, and it's considered best practice to begin with formal results and then move to the more informal or observational information. Make sure to use charts, headings, subheadings, so that your target audience can easily access your report and understand the information that you're providing there. So this section of the report is going to be the identifying information. You want to include all identifying information about the child, and It may look a little different based on the procedures for your school district, so you'll want to follow those, but generally you'll include the date of the report, the child's name, their birthday, the school district, teacher name, district ID number, all those different types of things. And just make sure when you date the report that you double check those legal timelines to make sure you are within your time frame. Next will be the reason for referral, and also include parent and or teacher concerns in this section. So you'll want to address why the student is being referred for an evaluation. Language delay, motor delay, maybe they've been receiving services through ECI, maybe have a medical diagnosis. There's a lot of reasons a parent or staff member might refer a child for an evaluation. This section may also contain history about other interventions that might have been tried, any private therapies that the child has received, any ongoing difficulty, cognition, language, or motor abilities. Make sure to also list the suspected disability or suspected eligibility. As an evaluator, I found that it's a common misconception among some teachers and parents that evaluations are completed to see what's going on or to get more information. And while the evaluation reports do provide more information, they're completed to see if the child is eligible for special education and or related services. So be specific in this section by listing one or more of the 13 IDEA eligibility criteria or categories, excuse me. And this also helps parents, you know, they want to give informed consent. So you want to make sure that they know what you're looking for when you're evaluating their child. Next is the evaluation methods section. In this section, you'll want to provide your name, your level of education, and all of the different types of formal and informal evaluation measures that you used in writing the report. Some evaluators include the date that each assessment was given or collected. It's not necessary. You can do that. Just make sure to include every piece of information you used in writing that report. You know, those could be the formal assessments, the developmental profile, the DAISY, the adaptive behavior assessment system. Also include those informal pieces, the parent information, teacher information, and play-based observations. Also include any health information that you collected, vision and hearing screening, doctor reports, ECI reports, private therapy reports, private evaluations. And if other team members are participating in the evaluation, they will list their information here as well. Next, we'll have the background information and sociological factors. This will include any information related to the student's family history, their siblings, if they've had changes in their family, such as divorces, moves, adoption, previous school enrollments, whether or not they've even had access to education. You're going to include all of those things in this section. You also include if the child is involved in any types of activities outside of school or within the community, such as the play groups or youth sports, things of that nature. I also include what the child likes to do outside of school, what they do at home, what do they enjoy doing at home? Do they enjoy playing with their siblings, or do they enjoy playing outside? Do they prefer to play alone? I'd like to list all of those types of things that just kind of paint a picture of what their life is like in the home and or community setting. And if any of those types of sociological or cultural or lifestyle factors might be a contributing factor to the difficulties that the child is experiencing. Next, you will discuss the speech, language, and communication that will address all aspects of a child's communication abilities. So you'll want to talk about the student's native language. What language, if anything other than English, might be spoken in the home, spoken to the child? How does the child communicate? Is verbal, or do they use sign language, pictures, or are they not yet using verbal communication? You're going to address their expressive and receptive language abilities. Do they follow directions? Do they understand what's being said to them? Are they able to communicate their wants and needs? Discuss their speech intelligibility, and if they reciprocate the communication efforts provided by others. And again, the play-based observation is a great way to evaluate this area. Next, you'll discuss the physical and medical aspects of the child. This section will include information regarding their vision and their hearing, their gross motor and their fine motor abilities, their birth history, history of developmental milestones. This section might include doctor's reports or information regarding their any private therapies they've received for fine or gross motor skills. Any information regarding the child's physical or medical information will be included in this section. Next, you're going to talk about their emotional, behavioral, and also their social functioning. And you'll want to talk about it across environments, including school, home, and community. So what this could look like is, possibly disruptive behaviors. What do the behaviors look like across settings? These behaviors might have a positive or negative effect on the child. Discuss that. Another factor would be the social functioning of the child. Does the child socialize with other children, siblings, cousins, adults? Discuss the nature of those types of interactions in regards to what's appropriate for that child's age. So much information can be included in this section, and also from a wide variety of sources as well. We have the intellectual and adaptive behavior skills. Intellectual ability can be assessed formally and informally. So formally, you could use that developmental profile. There's also the Woodcock-Johnson early childhood test that you can give. So you can also use informal information though, and you can gather that information through observations or parent interviews regarding their problem-solving skills, object permanence, remembering information, learning those familiar routines at home and school. That can tell you a lot about a child's cognition. And then adaptive behavior refers to those daily living types of skills and social skills. So you'll want to discover information about their communication, also how they engage in their self-care activities. Can they toilet independently, or toilet if they're working on toileting and feeding, drinking out of a cup or a bottle or a sippy cup, their level of independence, or even their level of just interaction and with those self-care activities. Conveying wants and needs is also a big one. And those age-appropriate danger awareness abilities, those are also a good one to look at for this section. Next is the achievement, and for young children, this will focus on pre-academic skills. So there might be a little bit of overlap on this section with the cognitive section information, and that's okay. There really are only a few formal assessments that measure pre-academic skills in very young children, so you'll rely heavily on those play-based observations and the parent information to learn a lot about those pre-academic skills. And those just include, does a child know their shapes and colors? Can they label common objects in their environment? Can they count? Do they know their letters yet? So have they learned familiar songs? to sing with their parents. So there's a lot of things that you can uncover here, but it's probably going to be using informal data to address this section for very young children. So that will bring you to your summary and conclusions, where you're going to sum up all the information and hit the highlights from each section. It does not need to include specific scores or tables, but you'll just want to include the main points from each previous section and touch on exactly what you want the reader to know about how you came to your eligibility determination conclusion. Unfortunately, this may be the only section that gets read of your report. So, make sure to summarize the information as clearly as you can in terms that lead to justification for your determination for eligibility and the recommendations that you are going to make. Also, in this section, make sure to clearly state if the child meets eligibility criteria, and if so, which of the 13 IDEA eligibility categories that the child meets the criteria for. And then you're going to make your recommendations. So your testing, your scores, your findings, your observations should all lead you to your summary and conclusions, and then those recommendations should come straight from your conclusions. So this should include how parents and caregivers can intervene in the home setting and how teachers can intervene in the school setting. What types of services you might recommend, what types of accommodations you might recommend, and if there might be additional pieces of evaluation that you would like to recommend. If maybe you saw something in this evaluation that wasn't quite covered and you might want to look a little further but need additional consent in order to do so. So these recommendations should be clear, they should be to the point, and they should not need interpretation to be implemented. So I hope that you gained some new information here from the lecture and PowerPoint. Hope it will be useful to you in completing the assignments for this module and Module 8. Don't hesitate to reach out if you have questions or need for clarification regarding any of the content. Y'all have a great week.